that don't quite fit our services, and we have to kind of bounce them somewhere else, because homeless in definition can be so wide, right? My version of homelessness is specific to my contract and kind of what we can serve. But that doesn't mean someone else's perception that they're homeless isn't valid, right? But we have to work with those that are specifically unsheltered on the streets of Montgomery County, that are placed not meant for habitation, are already unsheltered. So we get a lot of referrals for, I'm going to be homeless in a couple of weeks, or I'm going to be evicted, or I'm staying with friends and family that don't really want me here. Any of those sort of unstably housed, which are just as important, but unstably housed individuals we can't do anything with within our contract. We don't have the capacity to. The work that we do is 3 full-time outreach coordinator or outreach staff that are, again, out in the community, under bridges, in encampments, looking for individuals, and they just don't have that capacity to also do what is a little bit more prevention or diversion or things that are not yet street homeless. And oftentimes that's a really uncomfortable conversation for them to have with someone who's been told we can help and who's been referred to us, who's saying, well, why do you have to wait for me to be on the streets? Help me now. And I'm saying, I would love to. And here's some other resources, go here. But our team can't pick you up for case management when really all they want is someone to hear and listen to them and get them support now. And so I think just in clarifying that really our team, it's not that we don't want to, but we just don't have that capacity, and that we really need to focus on those that are already unsheltered and already on the streets of Montgomery County. That's the appropriate referral for us. We do a lot within another program that I run, but the homeless information line for Montgomery County. And so that line gets tips and calls to where someone will say, hey, I've seen this individual on the corner of my community or whatever it is. And my team actually goes out to then engage that person to see what their story is, what supports they could have. Do they want a shelter? Do they not want a shelter? Kind of what does that look like for them? And that's the referral that they'll go and interact with, as well as just regularly canvassing the community for seeing new individuals. But the referrals for all of the unstably housed, we just have to redirect to other supports in the community. So that's a little bit about kind of what would be the right referral. As far as veterans go, anytime, that's just sort of in our screening questions. If there's a veteran or military history, any of those types of things, just because it is a population that has so many more resources that we can quickly link them to. And so as soon as we find out that someone we've engaged has any kind of military history, we're working to find out what they could or could not qualify for, what else we can connect them with. And so very often we will find that out, and then we link over actually to the rest of you guys and what other veteran services they could support or they could access. So I think my referrals end up going out to the veteran community more than the veteran community coming to me, just a little bit.
That's, so what's important to know for your program then is that it's for emergency housing for unsheltered individuals. I
actually wouldn't even say emergency housing because I don't run housing. So where our case management is going to be engaging them on the streets where they are.
Okay.
And I'm going to, we offer assistance to access those things, those resources. We know of emergency housing, we know of shelters, we know of those types of things, but I don't run. And so that's the other thing that kind of gets confusing is people will contact me and say, well, this person needs permanent housing or this person needs emergency shelter. And I'm like, okay, here's the shelter number. So our program doesn't run or operate those. The homeless outreach just specifically does the street outreach, and then they would engage and refer to those other services.
Great. Now, could you in the chat enter that homeless line that you have?
Yeah, I mean, the homeless information line is, it was a partnership that we did with the county. It's been up and running year-ish, year and a half. March was a year, so yeah, about a year and a half. With, again, kind of that, just trying to centralize information. And so Montgomery County is not different than other counties where there's so much information and it's so hard to know where to go and who to call and who to access. And people call 45 numbers, leaving messages. The goal was to try to put a information line together that can give out those specifically homeless resource information.
Sure.
And so, yeah, that line, I will drop it in the chat. We do, as I see everything that calls in, because I oversee those reports as well, we get calls from other jurisdictions all the time, and from other states. So some of those will get redirected, but they do a really good job of saying, like, okay, if you want shelter, here's the number you call. You don't have to call the 15 other numbers. And kind of assisting in that way.
Great. Does anybody want to ask Betsy any questions specific to the program she's talking about? Clarify anything that she said? It's always helpful to understand the programs that are doing prevention, homeless outreach, or sheltering clients. I think it's really important because sometimes we're not really sure. So it's helpful to know those things.
Yeah, I think one of the other things that we do end up partnering with when it's possible is a program that had a participant that maybe the participant left. So we have partnered with programs before. They've said, we've been working with Mark, but he left. We think he's on the streets, and we can actually go do that outreach to see if we can find Mark, if we generally know where, we have a picture of him, or something like that. And so some partner with programs that way, that if the individual is living on the streets, right? I don't care that they have a permanent house. If they're living on the streets, we can try to go look for them and engage them, as long as they're, kind of within Montgomery County. And sometimes we can assist programs that don't have that staff to even go look for them on the streets.
Great. Okay. So any other questions for Betsy before we move on to the next panelist?
The only other thing I wanted to mention, and someone may talk about it, so I don't want to, but if it comes back to, the county does have a lot of supports and services right now to try to do prevention and diversion. So for individuals that are facing eviction, facing homelessness, those types of things, there's a lot of COVID funds and a lot of things kind of wrapped up in some of those preventative things. So again, my team's not going to administer them or run them, but there's a lot there from Montgomery County within the homeless system.
Right.
Try to have people not enter homelessness.
Right. And I do think we have some people who will be talking about those things as well. So hopefully that will we can add to the conversation as far as that goes. And actually Lynn from MCCH did send me a document discussing the specific COVID programs I think that are out there. So I can also share that with anybody. If it doesn't actually come up, we can pull that up. But for now, I guess let's move on, because James, you work for the Montgomery County Crisis Center, correct?
Yes, I do.
Yay.
Let me get back to you here. Yep.
Well, I'm going to have you go ahead and talk. Maybe you can help share what is, if we have a case and we want to provide them help, what would be the point at which we would refer them to the Crisis Center? When would we reach out to you?
Gotcha. I'll just kind of give you an overview and try to answer it the best I can. We're primarily for any kind of mental health concern. We don't see people on a good day. We see people on their worst day typically. We are linked pretty close with Montgomery County shelter system. So historically, they've had 2 seasons for shelter in Montgomery County, a summer shelter and a winter shelter. And in the summer shelter, you typically need to get a referral to get in. You would come through us to get a referral. COVID's blown that up. They've extended the shelter year round to winter type functioning. So there's there is no referral needed to get into the shelter. So men can go directly to the men's shelter, which I always get it mixed up. Is it 2 Taft or 6 Taft Court? And the women cannot go directly to shelter. The women cannot. They have to call the shelter ahead of time and do a telephone screening. And they're typically sending them over to Cofield Center, kind of holding them there for 2 weeks to kind of have them shelter in place for 2 weeks or quarantine. And then they're going to move them into the regular shelter system once they're kind of clear. So it's simpler to get into shelter, but it's not very pleasant, especially for the girls. They're having to quarantine for 2 weeks, and the men are doing it a little bit different. The county has set up a hotel as well for COVID positive folks, that they're sending them to the hotel until they test negative, and then they're moving them into the shelter system. Or if somebody in the shelter system tests positive, they will move them out of the shelter into that hotel setting, and kind of monitor them from there. And of course, if they need to go to the hospital, et cetera, and so forth. But most folks, aren't experiencing that, thank goodness.
Mm-hmm.
So we really have nothing to do with housing. I hate to say that, but we don't. And we don't run the shelter or work with the shelter, but us being open 24/7, the shelter often calls us a lot to come deal with crises at the shelter. And like I said, during the off seasons, people will come to us 24/7 to get that referral to go to the shelter. Montgomery County shelters right now are still being really strict on residency. So folks who are homeless got to prove they became homeless here in Montgomery County. If they're coming from Virginia, PG County, Howard County, they're not going to let them stay. Sometimes they might let them stay 2 to 5 days until they work out a plan. Sometimes they don't. It's in flux a lot of times. But they're really looking only to serve Montgomery County residents who lost their housing in Montgomery County.
Okay.
As far as when to call us, if in doubt, call us, put it that way. I'd rather have you say, hey, is this a case you could help me out with? I've got a client who seems depressed. He's not functioning. He's isolating. Or I have somebody who has a thought disorder, maybe schizophrenia, and they're responding to internal stimuli. They're hearing voices. They're paranoid, those kind of things. Those are the kind of folks that we can reach out to and try to help. I can usually get folks in to see one of my docs within 2 business days. One of my docs is coming into the office, and the other one's working remotely. So we're doing a hybrid of walk-in and remote stuff with the docs. Far as our mobile team goes, we're getting lots and lots and lots of calls for the last several months. I mean, when COVID first hit, it was crickets. Like everyone just kind of freaked out and buttoned up and didn't do much. But the last several months, we've been getting 6, 7 mobile calls a day. And those take 2 or 3 hours each time we go out. So it's a long day with those kind of calls. So if you have a client, a veteran, it doesn't matter if you're a veteran or not to us, who's struggling with a mental health concern, they can walk in and talk to one of our licensed therapists 24/7. It's a free service. There's no charge. We're not checking insurance. And if they do need to see our psychiatrist at that point, we do check insurance. So we're looking for people at that point who are publicly insured, Medicaid, Medicare, or uninsured. In a pinch, if somebody's privately insured, we'll work with them as well the best we can from there. Like I said, the best way is call us. The line's answer 24. You can't leave a message when you call our number. It's going to be answered by a live person, and the person answering the phone is a therapist. And so that, they're going to be able to walk you through what's going on and go from there.
Well, that's great. I appreciate you being able to share some information about the shelter system. I know it sounds like if you have a client that's in a mental health crisis, seems like the most appropriate sort of call into the crisis center. But I imagine like the rest of us, you get a lot of people looking for multiple needs. So I'm sure housing comes up, and it's nice to know that you have that, information about the shelters. Do you know if the shelters are experiencing any being full or hard to get into right now based on what's been going on?
No, we haven't experienced that. They've done a pretty good job of expanding. The Cofield Center is pretty big. They're using Progress Place as well. If you guys are familiar with that facility, I don't know if you are or not. Then they have the 2 shelters over on Taft, one for men and one women. So we really have 4 facilities we're using right now, which are typically what we use for the winter time, which when our numbers go over 200 for men and close to 100 for women. So, so far capacity, we've been able to manage okay.
Great.
Yep.
It's good news.
Right.
And I see you entered your information on the chat as well. So that's helpful. If anyone wants to check the chat out, we've got both Betsy and James have put their contact information in there. And I wanted to make sure I let everybody know too, that I am recording this. So if anyone's interested in having this recording, just let me know. I'm going to try to put together a document after this. It's not going to be perfect, but with at least some of the information we've talked about today on one page, that hopefully will be helpful to everybody as they're, working with clients in the future. But did anyone have any questions for James before we move on to the next panelist?
I did real quick.
Okay.
James, just outside normal COVID times, we would contact you for a referral to access the shelter system, correct?
Yes, during the summer. The shelter has two systems. During the winter time, which is typically November to March, no referrals are needed. Men can go straight to the shelter.
Mm.
Okay.
I can jump in on that for the homeless
Sure.
system. Actually, the referral shouldn't have to, they don't have to go through the crisis center.
Not any longer, thank goodness. Right, it's expanded.
So
And
it
in
has
general, the
expanded.
crisis center should not be the point of contact for that.
Mm.
Okay, because I think that a lot of people are still under the impression
Yeah.
that that's our coordinated entry point.
They sure are.
Yeah, because even I did, Jen. I'm glad you said that, because that's exactly why I reached out to James in those exact words. I thought they were the coordinated entry system in Montgomery County as well. So,
Right. And the crisis center is under the behavioral health. They're not under homeless services at all.
right.
Right. So what
Services has its own coordinated entry and has its own access points and in general. And if you call the homeless hotline, you're told to call every mind to get a referral for the shelters if needed, which James has said it's not needed right now, but
Mhm.
the outreach teams should be the point of getting a referral or contacting the shelter itself. They shouldn't be going through the crisis center at all if it's only to access shelter.
Okay, so use the Every Mind 24-hour homeless hotline number you posted, Betsy.
Well, that would then get you to the female or male shelters that you want to access.
Okay.
That's where that information comes from. There is not a coordinated enter for shelter. Nothing James said is wrong. The females are sheltering somewhere. The males are sheltering somewhere. That's correct. But nowhere should crisis center, and if you ask the homeless system, nowhere is crisis center playing a role in those referrals. They still do it because that's how historically it was kind of run, and people went to the crisis center because the individual is going to see their homelessness as a crisis. They don't care that it's not behavioral health or whatever they see it as a crisis. They go to the crisis center. They can get a referral for shelter there. But the shelter system and the homeless system isn't utilizing or telling anyone to utilize the crisis center in that way.
Hey, Betsy, real quick question for you. My experience has been, and correct me if I'm wrong, that those services are typically only open during business hours, Monday through Friday.
No.
Right. Because people are coming to us or saying, I can't get through there, so I came here. And at one point, our number was at the end of that message for the hotline as well. You can't get through, call us. And so a lot of it bounced back to us anyways, it felt like.
Oh, no, there's nothing on the hotline because I recorded that. There's nothing on the hotline that says crisis center. It does say if you're experiencing a crisis to call the crisis center because the hotline has a wait list or a wait time. It's not, it's answered by priority. And so the hotline is not always answered immediately. It's sometimes there's a wait on that line. And so the recording says that if this is a crisis, to call the crisis or to call 911 if you don't want to wait. But it doesn't say if you can't access to call the crisis.
Yes, we're getting tons of calls, so I will refer them to that number as well. That'd be great.
Yeah, I mean, anything within the homeless resources should be able to go through that line. And right now for the shelters, the access points, they are trying to control for both male and female to have to quarantine. Whether they're compliant with that kind of depends on whether they're staying at that shelter or not, if they're kind of doing that 14-day quarantine. And at both sites, depending on capacity, they're getting moved to other facilities. So the homeless system is operating many different sites more than we normally do. Because of the social distancing that's needed and all of those things, we have I think it's 3 or 4 different sites set up that we've never utilized before. The rec centers we've never utilized before. They were set up just for these COVID times to be able to social distance and still serve the capacity of individuals that we are serving, related to single adults, families, hotels, all of those other things that he did mention related to shelters. But the shelter access points can just be walked into. I think the calling is that people don't know where to access them right now because they're at different locations than they normally would ever have. And as we go into winter, that'll look a little bit differently as well, as one of the year-round, or not year-round, one of the winter female shelters will be reopening as well, which will be a different location and access and all those things. So getting that line and finding out where to access right then is kind of the most relevant for someone seeking shelter or seeking exactly unsheltered homeless services.
And that's unsheltered. So it's people. And so that's a number that people that are homeless and want help can call directly. It's not just to report a homeless individual on the street. Okay.
Yeah, and the shelter, to access the shelters, you don't have to be unsheltered. So you don't have to spend a night on the streets before you can enter shelter. That is
right.
The way it is. You can be with family or friends and then just go to the shelter.
Okay.
But as James did cover a lot, great job. You have to. There is a vetting process of being a Montgomery County, proving that you should have services from Montgomery County.
Sure.
Benefits or lost housing outside of Montgomery County, the shelters give you a very short stay. But for outreach, we can serve anyone as long as you're currently in our county.
Fantastic. I think that was really helpful to clarify. The main point of entry, at least for the best information, is going to be going to the Every Mind hotline rather than the crisis center, unless it's a mental health issue. And then you could refer them to the crisis center for a crisis.
Yeah, and I will say for families, so if your veteran is a family with minors, so they have minor children that are with them in there, and that's what for services we call family, anything that has a minor in their care.
Right.
They would still be assessed through the crisis center after hours.
Okay, right.
Shelter.
Okay.
So family shelter is a little bit different than anything that would be a single shelter.
That makes sense. Okay, well, thank you to both of you for clearing that up. I think that's really helpful. Any other questions on the topic on this with these two presenters here that we had? More county specific. Okay, so I also have Fatmata. It looks like you were able to come on. Well, she's here, but she must have something else going on at the moment, but she's here. She's going to talk with us from the VA. And then I also have Athena here. So let's go ahead, and Athena, if you want to talk about the Friendship Place SSVF sort of access for resources as well. And Chris too is here. We have Chris, Athena, and Mame are both from Friendship Place, or all three from Friendship Place. But I think Athena, you're here to really talk with us.
Yes, ma'am.
Yeah.
I apologize, everybody. I'm on my phone because all of my computers broke down. So I will put all my information after into the chat box because I cannot do that simultaneously.
Right.
Okay, so our program, SSVF, Supportive Services for Veteran Families, we are a housing program. We offer temporary financial assistance to veterans. I'll get into the eligibility a little bit later. So with that temporary financial assistance, we also offer supportive services like case management, housing counseling, legal referral, just a lot of other things as well. For example, with the temporary financial assistance would be something like paying for security deposit. But one thing that we do let the veterans know is that none of that financial service or long-term financial service is guaranteed. So it is very case by case, and they do go through that with the case managers. Right now, let me back up a little bit. So before COVID happened and we were in normal times, my team would go out and outreach to shelters. We would have office hours at the CRRC in DC to reach out to veterans, to screen them for the program. Since COVID, everything is remote. I will be putting our screening line number in the chat box as well, but that's kind of the #1 way that we are getting veterans to contact us. If any of you as providers have any questions, like follow-up questions about the program, or have a specific veteran you might have in mind that you wanted to discuss a little bit more, please feel free to email me or Mame directly. But for the veterans themselves, if you can have them contact the screening line, we do call back within 2 business days, but we are really trying to get that down into 24-hour return call to them. So the eligibility requirements is veteran status, but what that includes is at least 1 day of active service outside of training. The veteran can also not have a dishonorable discharge or bad conduct, general court martial. We do work with special, we do work with the special court martials, not the general court martials. Income level, the veteran as a household must be below 50% of the area median income per HUD standards. And then lastly, we are working with veterans that are unsheltered, literally homeless. Through the CARES Act, though, we did receive additional funds where we did take on some prevention cases, which is evictions or just veterans calling like, I'm behind 1 month on rent. I just need to catch up for this 1 month. Can you assist? We were able to enroll a lot during kind of the beginning of when COVID happened, but right now, because of that, we do have very limited capacity. We just did hire a new case manager, which will open it up a little bit more. So even though we are taking some prevention, we are prioritizing those veterans that are unsheltered right now. It doesn't mean that you can't reach out to us or have them reach out to us, because we are also trying to provide county resources to those veterans if we don't have any available intake slots available at the moment. But we still want to provide them with as much information and resources as we can. We also, through the CARES Act, had a program, the EHA Emergency Housing Assistance. So this is also limited capacity. There are additional eligibility requirements, but the goal of EHA when it first started was taking veterans who are high risk for COVID off of the street and placing them into hotels. So the eligibility requirements for that initially were 60 years of age or older, and or a pre-existing medical condition, and that's that would be something like respiratory disease, diabetes, cancer, just something that we have known that is very high risk for COVID, but also in a congregate setting. So sometimes we would get referrals for veterans who were like maybe in their car by themselves, but because they're not necessarily in a congregate setting, they're isolated, they wouldn't be recommended for EHA. But again, if you have questions, feel free to reach out to us. I can also, Melissa, send you our kind of EHA screening document where people can just go through and check the boxes and then forward it directly to us. And then we can just kind of correspond and see if they do meet the eligibility requirements for EHA. So that was kind of one of the newest programs that we did get out of COVID right now. Like I said, so everything is just via remote, even our intake appointments. We are trying to work very hard with veterans to do everything via telephone, screenshots, or emails, or if they're staying in transitional housing, which is something that we've been working with the VA with, having them screen for transitional housing, because with the limited capacity we have, some of our next intake availability appointment isn't until mid-October right now. So we have veterans who need a place to stay from now until they even do the intake with the case manager, and then they still have to get the paperwork. So it is a long process. And then with everything kind of pushed out, we were working a lot with the VA to at least get them some type of shelter, especially if they don't want to specifically go into a shelter, but they're a little more open to transitional housing. I'm trying to think. So in Maryland, so Mame, who is on the call right now, she's actually going to be taking over the Maryland area. She's recently new to the team. And in Maryland, we do service Frederick County and PG County, as well as Montgomery County. So kind of just an FYI. Also DC and some areas in Virginia. So that is all I have right now. If anybody has any questions regarding any of that.
So Friendship Place is SSVF. Do you know if there's any other SSVF in Montgomery County? I think there is, but I wasn't sure. Is it Housing Counseling Services?
Housing Counseling Services.
Okay, so just there are other organizations that cover Montgomery County. I don't know if there's another one besides Housing Counseling Services. Anything?
Yeah, there's Operation Renewed Hope Foundation.
Oh, Operation Renewed Hope Foundation is also SSVF. So I'm
Mhm.
sure, so they're probably operating similarly, although I can't assume that, but I would imagine they have some of the same resources. So if Friendship Place is at capacity and maybe unable to assist, you know, there's probably an opportunity to reach out to the others. Is there anything you all could suggest in terms of doing something like that? Does it, do you recommend that when veterans call, if you're sort of, if they're in an urgent situation and you're not able to, you know, do the intake quickly, is there going to another one sort of something that you are suggesting to do, or is it?
Yeah, sometimes what I'll do is if I just happen to know offhand who has availability. So for a while, like Housing Counseling Services right now, they don't have availability for rapid rehousing, but they do for prevention. And we're kind of flip-flop. We're prioritizing rapid rehousing over prevention. So we'll reach out to those agencies and just be like, hey, can you guys take this referral? If they can, then we'll forward the information. But if not, then again, we do provide county resources to the veteran. Also letting them know to, you know, give us a call back in a week just to see where we're at, just so they stay in contact with us, because we can get slots maybe added, but we don't know at that point. So it's just letting them know to continue to call us back, or sometimes they'll just say, just give me all the phone numbers and I'll reach out myself. And so we'll provide the information that way.
Great, that was helpful, thank you. So does anyone have any questions for the Friendship Place team on the call today? Okay. Then we have two more people. Since this is we're talking veteran here, I'm gonna switch quickly, if Carmen, you don't mind. We have Fatmata go in here real quickly with her resources over at the VA. Fatmata, do you mind just giving us an overview of how to get a veteran in contact with, and what are the best resources that you have to use right now for them?
Yeah. So, hello everybody. How are you all doing?
Good.
All right. All right. So typically what happened is that for now anyway, because of this COVID situation, we try to place them into EHA program through SSVF, which is a hotel placement. And we prioritize those who are more high risk for contracting the COVID virus. Otherwise, what I will do is refer them to transitional housing. So I'm the person that they will normally contact. And then I'll refer them to a transitional housing. I try to place them in Montgomery County transitional housing, though we also have the option of a DC, but typically when they're a Montgomery County resident, they would prefer Montgomery County. So I'll try and refer them to Safe Haven. We have two locations. One is closer to the Silver Spring area on V.S. Mill Road, and the other is in Gaithersburg, Laytonsville area. So it's a 6-month transitional housing program where they will be able to get intensive case management. We'll be able to enter them into HMIS, then they will show up in the county's by name list. And then during the VETS coordinated entry meeting, we'll discuss those cases and then decide what type of housing is most appropriate for them. Typically is if they're VHA eligible, I'm the one that the county will contact for them to find out if this is a VHA eligible person. And if they are, then it's typically a hot VASH referral. Then I'll be the one meeting with them and working on with them on those referral to hot VASH. Presently, unfortunately, our hot VASH team is not accepting referral for staffing related issues. So I will be relying mostly on county housing, PSH housing or rapid rehousing through SSVF, and then transitioning them from the SSVF transitional housing into hot VASH once they start, once our hot VASH team start accepting new clients. But most of the resources that I typically rely on comes from also SSVF because SSVF provides their contractors with the VA. They're the ones who provides the rapid rehousing and the EHA placement. And we just work together to find a long-term solution. Like we've had a couple of Montgomery County residents that were in EHA, and the plan was I provide case management along with the SSVF providers until the veteran was accepted into HODVASH, and then HODVASH took over. Okay.
So are you the main point of contact? Can we use you as a point of contact if we want to refer to any of these programs?
Yes, so I'm the main point of contact. I'm the outreach person for Montgomery County as well as the VA Safe Haven liaison.
Okay.
Yes. So normally I'll be the first that the providers will contact just to at least verify their veteran status. And if they are not VAJ eligible, then I'll report to the county that this person is not VAJ eligible, and then they still get on the by name list, and then the county refer for housing, the COC.
Okay, so the by name list is the list that is all of the homeless people in each organization is added to the same list. Is that correct?
Right. So typically whoever outreach the person really will place that person into that person information in HMIS, and that's how they will get, that's how they will be known in the by name list.
Okay.
So just to clarify too, for people, the by name list, in order to be on there, like, so if we're serving a client in Montgomery County, like here at Safe Havens, we have tons of clients that come from all over. They only get on the by name list for Montgomery County if they're a Montgomery County resident. So, we might have tons and tons of veterans that we're working with, but the only people on the list will be the Montgomery County resident. So lost housing in Montgomery County.
I see. Okay, it's good to know. Okay, so HUD-VASH is not accepting referrals, but if you're looking to refer someone to a transitional home or additional SSVF programming, you can go through your outreach, Fatmata, correct?
Yeah.
Is that right? Okay, great.
Yeah.
All right. Well, does anyone have any questions for Fatmata? Great. I just want to let everybody know before we move on to Carmen that there is some activity in the chat. There are some programs have listed some of their contact information. So if you're interested and want to check that out, you might want to take notice. Betsy did add some additional information in there as well about their outreach and contact information. So I will go ahead and let Carmen talk with us a little bit about the programs they can offer. Thank you, Carmen. Thanks for being patient.
Thank you, Melissa, for inviting me, and thank you all for being here. So my name is Carmen Castro. I'm a certified housing counselor, and I also serve as the manager for the Montgomery County Office of Housing Initiative Partnership. So we are an organization that's been in existence for a little over 30 years, initially with headquarters in Prince George County, Hyattsville. We moved to provide services to Montgomery County residents in 2009 as a result of the foreclosure crisis. So currently we are a comprehensive housing counseling agency approved by HUD to serve all of Montgomery County residents regardless of income or housing situation. We serve both homeowners and renters with any kind of needs. So I'll quickly go over like the kind of services that we provide, including pre-purchase counseling to prepare first-time home buyers, post-purchase counseling, which deals with homeowner related issues like including refinancing a mortgage, selling a home, taking care of their finances, obtaining a home equity line of credit, reverse mortgage, that kind of thing related to homeowners. Our rental counseling program that's currently like very, very busy as a result of the COVID-19 crisis. Has been in place for a few years already. And lastly, our financial counseling piece that provides support in different areas of budgeting, credit counseling. We help families look at areas where they can save some money, reduce expenses, increase income. That's some of the services that we cover, or a combination. Sometimes clients come with something definite in mind related to a particular issue they're dealing with, but we invite them to participate in our financial capability program. So right now, our services are all remotely. As a result of the pandemic, we are now serving clients over the phone. We do have 2 offices in Montgomery County, though. One is located at the Up County Regional Service Center in Germantown. And what we're doing is that we're serving clients by taking up documentation that they need to provide to qualify for rental assistance programs. So right now we are starting to provide this service related to phase 2 of the HHS COVID-19 rent relief program that just became, started last week. So there is a portal where clients have to submit some information related to their being late on their rent in order to qualify for assistance from the county. So we're providing that kind of support for those who may not be great using technology and uploading documents and submitting an application over the portal. We provide that service. Our certified housing counselors are bilingual in English and Spanish. So that helps us reach out to more people. Our services are free of charge, regardless of income. The only criteria to qualify for housing counseling services through our organization is that they show that they're Montgomery County residents. We don't check legal status. We serve everyone regardless of housing situation, anyone from like clients or families that may be subleasing rentals, like basements or rooms in a home, to homeowners who may be experiencing some kind of hardship. Right now, we're focusing on eviction prevention. Many families have experienced loss of income. We know it's a result of COVID-19. So we're working with Department of Housing and Community Affairs, reaching out to the families that need or could benefit from our services, and connecting them with the programs that are available to them regarding paying for rent, utility payments, and other resources like food, healthcare, other organizations that may provide assistance with applications for unemployment or food stamps. We just try to connect them with as many programs as we can determine that they may be eligible for. We also provide assistance with the renters and the homeowners tax credit. Those programs expire very soon, October 1st. Usually they go based on income reported on taxes from the previous year. So we expect that next year we'll have a bigger number of people that may qualify for that particular program. So that there are two sides of it. One for renters and a tax credit for homeowners who make up to $60,000 a year. So it's a very busy time for us. We're getting lots of calls, referrals, and working with the Department of Housing and Community Affairs and the Department of Health and Human Services. Up until recently, the message was out to call 311 and go on a waiting list to get assistance COVID related. The program is open now and is taking applications. So we want to refer as many families as we can prior to the deadline of December 31st. I can answer any questions related to that specific program or anything else that relates to evictions. I know we've been getting information on a state level and national level in regards to eviction moratoriums on evictions, and there are some details that we need to communicate with clients, not to just assume that they'll be protected, because it doesn't cover all types of cases. We're just talking about failure to pay rent. So there are some steps that tenants have to do to protect themselves from eviction, at least through December 31st, where the moratorium is set to expire. So the more we can do, the more people we can reach, I think the better. So if I can be of any assistance to any of you, I'll be happy to or answer any questions in the time being.
Thank you, Carmen. So my understanding is that you're going to be a resource for homeowners too, which I think sometimes we do get calls from clients that are, falling behind on their house loans, and they're interested in support for that. So that's good to know that there's a resource out there as well for those callers. And in terms of the COVID relief, so you would be a good organization to sort of offer assistance through that whole process then, and get information to clients about the protection, the protection that they have in terms of facing eviction.
Yes. So luckily for homeowners, most of the clients that we serve have taken advantage of mortgage forbearances.
Yes.
That were put in place at the beginning of the pandemic, in which mortgage companies just offered to suspend mortgage payments in increments of 3 months. So all they have to do is just request extensions. Some clients have already requested extensions a couple of times. So we're very worried about what's going to happen after all these protections expire. Right. So we want to be in contact with families early on and tell them about those protections, both for homeowners and renters.
Great. I know you emailed me a document. Did you want me to put that on the screen real quick, or for everyone to see?
If we have time, I could quickly go over it.
Let me just show it, because you asked me to, and I want to. Let's see.
There's something else that I wanted to mention. We're working in a partnership with DHHS.
Sorry.
On on a pilot that's going to be starting in a couple of weeks, called the Home Share program, and we're going to be looking for homeowners that may be interested in sharing like a room or basement or an ADU in their homes to renters, so that they can also benefit either from the companionship or the actual financial incentive. So that's another program.
Wonderful, thank you. I was trying to share the document, but I'm struggling a little bit here. I'm gonna let you all talk too. I have Virginia, and I also asked Nick, who's on here from Bethesda Cares. Virginia, you're with Montgomery County Coalition for the Homeless, and you're with the Safe Haven Transitional Home Program, right? That Fatmata was talking about.
Yes. So Fatmata did a really good job of kind of, setting that up. Probably the most important thing to know, if what I described as far as a program, you're like, oh, that sounds like something would be really great for someone I'm working with or someone I've come in contact with. Probably the biggest thing to know is to go through Fatmata. If for some reason you can't get a hold of her and you get a hold of me, the first thing I'm going to say is call Fatmata. It is really cool lately. I think where our program is getting more community exposure. I have had a lot more people reaching out to me saying, hey, I got referred to you. And, I think that our program your program would really be beneficial for a veteran I'm working with. Getting a lot of referrals for veterans that are incarcerated, that are getting ready to be released, which is really exciting for me personally. That's a big community crossover that I'm interested in. So not all those veterans are always eligible. That's what Fatmata was referencing, is we use VHA standards. And basically that means that there is certain criteria they need to meet. They need to have a discharge that's not dishonorable or bad conduct. And they need to have served a certain amount of time. Now, how much of that time is there's a lot of like, if you can just Google like VHA eligibility and it'll tell you, but there's certain standards for if they served before 1980 versus if they served after 1980. How much of that time, it also has to be like, like a certain amount, it has to be consecutive, it has to have been in a non-training capacity. So for instance, if they did like a full 4 years of National Guard but were never activated, they don't, they're not eligible for VHA. So rather than like trying to parcel all that out, it's easier for me just to go, hey, Fatmata, you know, and she'll put it in the system and look and see what the eligibility, if that person meets the eligibility standards. So she also is the gatekeeper as far as making sure people coming into our program that it's equitable, as far as you know, she keeps kind of a waiting list of referrals. You know, we do prioritize people who are, you know, street homeless versus somebody who's like maybe couch surfing. They're homeless, but they're couch surfing, you know, that kind of stuff. She's the one who's able to make those kind of determinations. Also people who maybe have somewhere to stay for a couple of months versus, but definitely not permanent or not, you know, a good place versus somebody who's like, oh, this, you know, 70-something-year-old veteran is getting evicted out of his house. He's going to be on the street kind of. So she's the one who kind of helps make those determinations and directs veterans our way, which is really great. So just a really like basic rundown. We are transitional housing. We are funded. We are an independent nonprofit, Montgomery County Coalition for the Homeless, but our safe havens programs are funded through VA contract. We have 2 locations. One is in Silver Spring, which is where I am right now. It is like a residential style house that would take up to 7 male veterans at a time. We do have 24/7 staffing, and one of our, we are an SMI program, so we sort of specifically take clients who are diagnosed with a serious mental illness, often dual diagnosed, because we have the capacity to really handle what some other programs might not be able to. We have a pretty high standard of training for our staff. So as far as like de-escalation, medical and health safety, things like that. So we really are a program that can take pretty much anybody. We do, while they're here, we pretty much are a one-stop shop. I do refer people out if it's something that falls outside of what I feel comfortable as far as like area of expertise, but I try really hard to be able to do pretty much anything a veteran would need, starting with like, you know, them coming in, initial assessment, referring for medical appointments, getting them means tested if they need so they can even access VA healthcare, applying for any and all ID documents that we can get for them. If anyone wants tips on like creative ways to get ID documents for people that don't have any, I've found every loophole there is to get people ID documents. Ultimately referring them for benefits, doing service-connected claims, SSDI, any kind of financial benefits, and then working really closely with Fatmata and the VASH liaisons to figure out if people are eligible for housing vouchers. If so, and that's a lot based on residency and things like that. So yeah, this is our Silver Spring location. And then we also have a location in like Laytonsville / Gaithersburg. I think the mailing address is Gaithersburg, but it's really close to Olney. That is our, it's a little bit more out in the country. It's a 2-house site. So it's got the front house has the capacity to have 5 veterans. And we have that designated for women right now. So we take female veterans there, and then our back house, which is like 150 yards back on the same property, is for men, and we have up to 6 men that we can put in that house. That house is actually ADA approved, so we do take clients there that are in wheelchairs, things like that. We are actually able to serve people with that level of need, so which is really great. I'm trying to think what else is like really important as far as, I don't know, I guess if anybody has any questions. I think the really big thing for me is in just sort of as, you know, doing case management, different things, working in the community, is finding, and that's the cool thing about doing transitional housing. I get to work with clients for 6 months. So I really do get to provide pretty comprehensive case management support, mental health support. Oh yeah, that is our program is required to have both our case manager and our lead case manager / program manager, which is a position that is currently unfilled. If anyone knows any LCSWs that want to come work for us, but we do require that both of those positions be filled by professionals with licenses, and that's so that our primary focus is not mental health, because of the fact that we serve almost exclusively clients with serious mental illnesses, we do provide like light touch mental health, and definitely do a lot of evaluation to refer out for stuff like that. But yeah, I was just gonna say, like, as far as working a lot in this community, because I get to have clients for so long, I work really hard to build up resource databases as far as like housing resources, points of contact. I've got a contact sheet. Like, if you call me on your cell phone, I will say that number and you will never get rid of me. As far as finding out, you know, people in the housing authority, who do you call when you have this specific problem? Like, I have had a client where it's like, hey, I can't get an inspection done and it's been 6 weeks. Okay, well, I've got this person at the DC Housing Authority that schedules inspections. I can call them. So, and I would love to be able to work more and network with other providers, because I think we all kind of have our back pocket contacts, the people that, you know, are fixers and things like that. Sometimes two things just fall in your lap. I got the regional manager for Resident One, which is a property management company in Montgomery County, and also DC and PG, but she called me kind of out of the blue. I don't really know how she got my contact information, and basically was like, hey, I want to like partner with you guys so that you guys get first crack at our open properties. And I was like, absolutely. So now she sends me an email once a month that just lists all their available properties in Montgomery County. So we kind of know before they're even sometimes listed on the website, like what's going to come available. So we can put in our referrals for our clients to apply to those properties. So I don't know. Yeah, it's just cool, kind of cool stuff, you know, and if other people have resources like that, I think it would be really neat to share across programs, like, and that kind of, to open up those kind of resources.
Well, thank you. Thanks for offering your resource list to all of us. I'm sure we'll reach out to you if we have needs like that. I know we do have to share. It's nice to, that's why I wanted to have as many people that I could think of to be on the same page here, to talk about the resources, to clarify what we all do. Because as you can see today, there are a lot of resources out there. It's just knowing the right time to use them and for who. So hopefully this was helpful. And Nick, I did want to make sure before I have Julie talk that I give you a chance to give us a quick overview of what you have, because Bethesda Cares also has a specific veteran program as well. Do you want to talk, just let us know, like, so for instance, who would we refer to you and how?
So most of the referrals that I get, so there's two different elements to the veteran program. One is the housing program, and it's rapid rehousing and permanent supportive housing. And those referrals are all going to come through the COC through Montgomery County. We don't take referrals directly, but we do individuals and families in rapid rehousing and permanent supportive housing. And we also do bridge programs with for the VASH program. So we'll do the housing and then transfer them over to the VASH voucher.
Mm-hmm.
Where I can take direct referrals is that I have money to pay for eviction prevention.
Okay.
And if a person has a DD 214 and an eviction notice, I can pay up to $600 to assist with that. Mm-hmm. Lots of times it requires a partnership with some other folks, including the county and some of the church programs, to get to the right amount. But I'm happy to be a part of that program, and the budget just renewed, so there is a good pot of money. And I'm talking to lots of people who thought that they qualified for the moratorium, and it turns out they don't, because there's a lot of little loopholes in it. So
yeah, that's what Carmen was mentioning.
Yeah.
So not everybody is going to be safe from the moratorium, saved by the moratorium. So it's going to potentially come up that some people are going to be facing eviction, and in those cases, we can look to HIP and also perhaps Bethesda Cares as well for some of the funding that you have for that. Or Carmen, you don't actually have funding, but you can assist with the paperwork needed, correct?
Right, for the county program.
Right.
That program gives out to $4,000 to renters who are already 30 days late on their rent payments.
Mm-hmm.
So we can facilitate submitting the paperwork for that particular program.
Okay.
So, Carmen, so Melissa, this is about the case we conferenced earlier. So the family, they seem to think they're safe because of this moratorium, and they may not be, because they actually are in their place. But I expect I've been asked to leave in October, and they are thinking they can stay there till the end of the year. So would I give their number to you, Carmen, directly for them to call you, and then you explain to them what their rights are, whether or not they are going to be able to stay beyond the October 12th?
I don't know, what's the October 12th?
October 12th is when the landlord is asking them to leave.
Okay, yeah, we can look into the case and see if it's related to the failure to pay rent, which is protected, or if it has to do with something on the lease agreement or like tenant holding over, which is not protected. But they can call us. When they call our number, we will assign a housing counselor that will open their case over the phone and will provide all the information and see if they're eligible for any assistance. We'll help them with the application.
Okay, and what number should I give them to call?
Our intake number, which is 301 916 5946.
5946. Thank you. I'll give them.
Great. Okay, well, I hope everyone had an opportunity to share as much as they wanted to share. I know there was a lot of people to sort of get in here on this meeting, so I appreciate everyone being able to, just give a piece of what it is. I'm sure their programs do a lot more, but I will try to decipher what I could pull from some of this and create some sort of document, and that way you all have something you can look at later. But I wanted to make sure to give Julie some time, because I offered her some time at the end of the meeting to talk about the Blue Star Family Survey, and probably this is something that contributes to some degree as well with what we're discussing, because the more people that fill the surveys out, the more we know about them. Is that correct, Julie? I got that right?
Absolutely. Thank you. I don't even have to say anything.
Segue, right?
Absolutely. But first of all, Melissa, I wanted to just say how valuable this is. For many years, I know in that position, I was trying to crack the housing questions, and this was such a great forum that you put together with all the different people being able to just be in one place at one time. So thank you for that.
I appreciate everybody's, like I said, participation. There's a lot of different ins and outs here to understand. So, and I know once I figure it out, it'll change, but at least we can start from somewhere, right?
Yeah, absolutely. So I just want to speak briefly. Hello again. I know I've spoken about Blue Star Families to this group, and so some of you might have heard this, so I'm not going to go through a full briefing. But what I am doing actually is just sort of reaching out and appealing to my veteran friends and my friends who work in the veteran space to help me get word out about the Military Family Lifestyle Survey. Just for a reminder, Blue Star Families is a nonprofit organization that we empower military families and veteran families and guard families and reserve families to thrive by identifying challenges and implementing solutions to help with those challenges. And the way that we identify those challenges is by our annual Military Family Lifestyle Survey. We're in our 11th year of fielding this survey. Last year, we had over 11,000 respondents nationwide. And information from the survey really, it helps us to inform national and local governments, nonprofit agencies, funders, the Department of Veterans Affairs, provide testimony on Capitol Hill, a variety of things that we can do with this information, as well as other organizations use the data to do those things as well. So the data really is, for all of you who are working in the veteran space, it can be a tool that you can use either to answer questions you might have, to have proof of data to support the assumptions or beliefs that you have about a certain trend, as well as to be able to I just lost my train of thought there. It'll come back. Oh, maybe identify programming that's a good idea for you to follow down a path with certain programming and developing programming that are meeting actual identified needs. So I really feel like this is a community survey, and it serves us all. Our fielding this year is completely virtual, which is a little bit different, which it hopefully will not prove challenging. I can get out to a wider audience, but I also can't kind of get in front of people and be like, take the survey, as much as I used to be able to. So I'm reaching out to my my fellow community partners to ask that you help me to distribute information about the survey and encourage others to take it. I have a goal of 500 respondents in the National Capital Region, which doesn't sound like a lot, but you know, in 6 weeks, getting 500 people to actually sit down and take a survey that takes probably 20 minutes. I won't lie, it's an in-depth survey. I do definitely need the help of everyone to get the word out. But moreover, my focus this year is to get the word out to a diverse population of individuals. Our survey is typically taken by active duty military spouses and active duty military spouses at a certain pay grade. And so what I'm really focused on this year is having a representation in the survey that reflects more clearly and more truly the wide representation of our military community, as well as our veteran community. And so I'm really pushing for our veterans to take the survey so we can get more respondents. The more respondents we get from the veteran population, the more data we can cut, the more information we can share with your organizations, the more beneficial it is to everyone in the veteran space. And so I would ask that each of you take the survey yourselves. If you are a military connected at all, including the child, you can be a dependent of an adult dependent of a military person. You can be spouse, you can be veteran, you can be active duty, retired, that type of thing. I just turned off my Zoom. There we go. I couldn't find you guys. And I just put the link into the chat of the link to the survey. But I'm also asking, and I'm asking Melissa if she wouldn't mind, after this, I'll send out information about with, you know, like canned information, a logo, an image, and a little blurb, and asking you all to throw it up on any sort of social media or to your networks, or if you can email it out to your population and just encourage others to take the survey. I even have a survey card that I'll send Melissa that has a QR code so that when our partners here send it out, the person doing it can actually literally pick up their phone, take a picture of it, and it populates the survey, and they can take the survey right there on their phone. Although I do recommend if you're really taking the survey, you probably want to take the survey on a laptop because you're going to be, you know, typing and stuff like that. But anyway, so that was my ask. This is a really important push for me to really just broaden the representation of who we have in that survey. I want a wider voice to come back. Last year, we were able to get over 500 respondents in the National Capital Region, and they were able to not only cut the data nationally, but locally. So I actually have data specifically to our area, but we weren't able to get enough veterans to have them included in that data. And so I want to make sure that next year when they cut the data for National Capital Region, I can hand you all the veteran piece and say, here's what our veterans are actually saying. So I appreciate the time. If you have any questions, I will put my email here in the chat, and then I'll ask Melissa if she would be a sweetheart and send other stuff out to you all after the meeting.
Of course.
Thank
Julie,
you.
by the way, last night you got a plug at the commission. They mentioned your survey.
Thank you.
So the plug was there. And then also, if you want to forward it to me, I can send it up the chain and see if we're able to send it out to our provider council.
Wonderful. Thanks, Jen. I really meant to be there yesterday. My daughter had practice and I had to take her to it. So I appreciate that there was a plug at the commission meeting.
There was.
Thank you so much. I will definitely send it to you. Wonderful. Thank you, Melissa, and everyone.
Thank you. I definitely see the value in all this information and getting a good idea of what's really going on out there. So hopefully you can reach your goal. I think you will. We'll help you.
I want them to be like, this is the best ever we've done with veterans. And I'd be like,
of course you do. Why wouldn't you? Okay. Well, again, thanks everybody. If you have anything you want to share, anything you didn't get to share that you'd like for me to get out to everyone on the collaborative, feel free to do so. And I just appreciate your time. And does anyone have any last words before we shut the meeting down? Okay, great. Well, thank you. Again, I have this recorded, so if you want to share it, it's a lot of really great information. If you know people that would just like to watch the recording, I'm happy to share it. Thanks so much. You guys have a great day.
Bye, everyone.
Thank you.
Yeah.